The Johns Hopkins Fall Risk Assessment Tool is replacing the Hendrick II Fall Risk Factors. Johns Hopkins provides options that capture patients who may be low fall risk, yet would score as a high fall risk on the Hendrick II. The General Safety section is located in the Adult PCS Body System Flowsheet, and the Safety Assessment is still a required section. Safety risk is documented as accept, and the high risk fall precautions and possessions are documented. The Johns Hopkins Fall Risk Assessment Tool is below the safety rows. To the right of the flowsheet rows for the Johns Hopkins Fall Risk Assessment Tool is the value information that shows the value for each row when highlighted. The following is a demonstration on documenting safety about Vera, who is a 35-year-old with limited mobility due to a past trauma. Vera fell 2 months ago at home, and she is incontinent of both urine and stool. She currently takes Ativan and gabapentin daily. In order to ambulate safely, she requires a gait belt and cane due to her unsteady gait and needs someone to walk with her. She is forgetful of place and time and tries to get up on her own. The first row of the Johns Hopkins is the automatic low fall risk qualifier for patients having complete paralysis or who are completely immobilized. This covers many patients who are incapable of getting out of bed on their own. When this low fall risk qualifier is selected, the fall risk assessment row is automatically filled in as low fall risk. Because Vera does not fit this qualifier, we will move on. The age row gives an age range to select. Vera is younger than 60 and scores a 0. The fall risk has 2 choices, and each choice has an accompanying score: 0 for no falls within 6 months prior to admission, or 5 for 1 fall within 6 months prior to admission. Vera scores a 5. The elimination, bowel, and urine row provides selections ranging in score from 0 to 4. Vera is incontinent and scores a 2. The medications row provides selections related to medication the patient is taking that may contribute to fall risk, with a scoring range of 0 to 7. Medications that put a patient at risk include benzodiazepines, antipsychotics, antiepileptics, and antidepressants. Vera is on 2 medications and scores a 5. The patient care equipment row scores from 0 to 3, depending on additional equipment required to assist with mobility, such as a walker, gait belt, cane, and immobilizer. Vera uses a cane and gait belt, so she scores a 2. The mobility row scores options range from 0 to 2, with the ability to select multiple options, so the score could be 6, such as requiring assistance or standby for any stage of mobilization, as well as unsteady gait, or sight or hearing impairment that affects patient mobility. Vera scores a 4. The cognition row has multiple options, ranging 0 for no cognitive limitation to 7. If all 3 cognitive limitations are present, Vera scores a 6 for being impulsive and lacks understanding of her physical and cognitive limitations. Given Vera's criteria, she receives a total of 24 for total fall risk score and is automatically assessed as high fall risk on the risk assessment row. The high fall risk row follows and is yes/no option. This row flows to the other flow sheets that contain the high fall risk row, such as the PCT Daily Cares flowsheet. The final row in the Johns Hopkins tool is the patient place of last fall, with options such as hospital, home, current admission, and nursing home, as well as other. When the data is filed and the score is high, a BPA pop-up appears adding the high fall risk care plan template.